Stop sleeping like that. Seriously. The position you've been using for decades might be quietly harming your health without you realizing it. The scary part? You likely won't notice the consequences until they're already serious. If you're over 60, how you sleep isn't just about comfort anymore. It directly affects your heart, spine, brain, and even your lifespan. A major study in the Journal of Clinical Sleep Medicine followed more than 12,000 adults for almost 10 years. The findings were startling. Certain sleeping positions increased the risk of cardiovascular problems by as much as 34% in older adults. That's right, just the way you lay your body at night could be putting your heart at risk. Gets worse. Research from Stony Brook University found that sleeping incorrectly can reduce your brain's ability to flush out toxic proteins by over 40%. These proteins, including amyloid beta, are strongly associated with Alzheimer's disease. So, while you think your brain is resting, it might actually be accumulating damage over time. The good news? Scientists have also pinpointed positions that protect your health. Sleeping correctly can improve circulation, support spinal alignment, and help your brain clear out toxins efficiently. And the best part? These changes are completely free. You don't need expensive beds, special devices, or medications. You just need to know the right positions and how to adjust your habits. In this guide, I'll walk you through the 4 sleep positions that people over 60 should stop using immediately and show you the safe alternatives. I'll explain the science behind each one, provide techniques to make the changes comfortable, and share clinical data so you can see the measurable benefits. We'll count down from number 4 to number 1. I saved the most important position for last. A 2023 Stanford study discovered that one particular adjustment reduced dangerous nighttime oxygen drops by 61% in older adults with breathing problems. 61%. Stick around for that, it could literally change your life. Before we dive in, drop your age and location in the comments. We read every single one, and we love connecting with our viewers. Number 4. Avoid twisting your torso. Keep your spine aligned. The twisted torso is a sleep habit most people don't even realize they're doing. It happens when your upper body faces one direction, while your hips or legs rotate in another. Maybe your knees fall to the side while you're on your back, or your shoulders twist toward the ceiling when lying on your side. This creates a spiral effect through your spine. When you're young, your discs are flexible, muscles recover overnight, and a little twist doesn't hurt. After 60, however, discs lose hydration and flexibility, muscles recover more slowly, and spinal stress has a bigger impact. A Spine Journal study of 300 adults over 60 found that 72% had significant lower back disc degeneration. Twisting your torso at night accelerates this process. Twisting also puts uneven pressure on your vertebrae. One side becomes compressed while the other stretches, inflaming the facet joints, the small stabilizers between vertebrae, and causing stiffness, chronic pain, and long-lasting morning discomfort. Johns Hopkins researchers reported that seniors sleeping twisted were 2.3 times more likely to experience back stiffness lasting over 30 minutes. Twisting can even affect internal organs. Your stomach and intestines may be compressed, leading to acid reflux or digestive discomfort. A study in the American Journal of Gastroenterology found that seniors who slept twisted experience 47% more nighttime heartburn than those who maintained proper spinal alignment. The solution? Maintain an aligned spine. Keep your shoulders, spine, and hips facing the same direction. Place a pillow between your knees to prevent hip rotation, and use a body pillow behind your back to avoid rolling onto your back. A medium-firm mattress is ideal to support your natural curves. Oklahoma State University research found that switching to medium-firm mattresses reduced back pain by 48% in just 4 weeks. A contoured pillow supporting the neck keeps your head and spine properly aligned. Number 3. Avoid raising your arms. Keep them down. Sleeping with your arms overhead feels natural for many people. Some fold their arms under a pillow, others stretch them straight up beside their head. While it may feel comfortable at first, it can compress nerves and blood vessels in your shoulders and upper arms. For people over 60, this is risky because of thoracic outlet syndrome, a condition where nerves and blood vessels are squeezed between the collarbone and first rib. Age-related changes make this space even tighter, and raising your arms overhead intensifies the pressure. A Cleveland Clinic study tracked 180 seniors who experienced numbness or tingling in their hands. 63% regularly slept with arms overhead, and after switching to an arms down position, 71% saw significant improvement within 6 weeks. Overhead sleeping also strains the rotator cuff muscles that stabilize the shoulder joint. Tendons naturally lose elasticity with age and are more prone to tears. The Journal of Shoulder and Elbow Surgery studied over 500 adults, aged 60 to 80, and found that 40% had some degree of rotator cuff damage, often without daytime symptoms. Sleeping with arms overhead exacerbates this strain for hours every night. The fix: keep your arms at your sides or resting lightly on your chest. Small pillows or a body pillow can provide comfortable support and discourage overhead positioning. Gentle shoulder stretches before bed, like doorway stretches or shoulder rolls, can reduce nighttime arm repositioning by 38%, according to the European Journal of Physical and Rehabilitation Medicine. Number 2. Sleep on your left side, avoid the right side. Sleeping on your right side might seem harmless, but for seniors, especially those with heart conditions, it can add stress to the cardiovascular system. Your heart sits slightly left of center. Lying on your right side causes gravity to pull it toward your right lung, slightly increasing cardiac workload. Echocardiography studies in the Journal of the American College of Cardiology found that right-side sleeping increased cardiac volume by 8%. Healthy young hearts tolerate this easily, but for aging hearts or those with heart failure, it's significant. A study in the International Journal of Cardiology followed 240 heart failure patients and found 23% more hospitalizations among right-side sleepers over 3 years. Right-side sleeping also affects digestion. The stomach and pancreas are on the left side. Gravity isn't helping when you lie on your right, increasing acid reflux. Research in the Journal of Clinical Gastroenterology reported 40% more reflux episodes for right-side sleepers. The solution: sleep on your left side. This improves heart efficiency, aids digestion, and supports lymphatic drainage. Use a body pillow behind your back to prevent rolling to the right, a pillow between your knees for hip alignment, and consider elevating your head slightly. Studies show that left-side sleeping with a 30 degrees head elevation can reduce nighttime reflux by 90%. Number 1. Elevate your upper body, avoid flat back sleeping. The single most important change you can make is this: don't sleep flat on your back. Flat back sleeping can cause your tongue and soft tissues to fall backward, narrowing the airway. Younger muscles usually cope fine, but after 60, airway muscles weaken. The American Academy of Sleep Medicine found that adults over 60 experience 33% more airway collapse in flat back positions. This can lead to sleep-disordered breathing, snoring, and sleep apnea, which are not just annoying but dangerous. Oxygen drops repeatedly, forcing your brain to partially wake you dozens or even hundreds of times per night. The New England Journal of Medicine reported that untreated sleep apnea increases the risk of cardiovascular death fourfold. The Stanford study mentioned earlier showed that elevating the head 20 to 30 degrees reduces dangerous oxygen drops by 61% in older adults. Elevated back sleeping also reduces reflux and helps the brain flush out toxic proteins like amyloid beta. Stony Brook University research indicates that flat back sleeping decreases brain waste clearance by 40%, allowing harmful proteins to accumulate. The solution: raise your upper body 20 to 30 degrees using a wedge pillow or an adjustable bed. Combining elevation with left-side sleeping gives the best overall results for heart, airway, and brain health. If you don't have an adjustable bed, firm pillows or a foam noodle under the mattress head end can create a gradual incline. Start gently, 15 degrees for the first week, then increase. Most people adapt within 2 weeks. Summary and challenge: for twisted torso-aligned spine, reduces spinal stress, disc degeneration, and organ compression. 3 arms overhead, arms down, protects rotator cuffs and nerves, improves circulation. 2 right side, left side, helps heart function, digestion, and lymphatic drainage. 1 flat back, elevated back 20 to 30 degrees, opens airway, reduces reflux, improves oxygenation, and enhances brain toxin clearance. These adjustments cost nothing, have no side effects, and require no medication. Yet research shows they can significantly lower the risk of heart disease, cognitive decline, chronic pain, and sleep disorder breathing. Here's your challenge: pick one change tonight. Stick with it for 2 weeks, then add another. Within a couple of months, your sleep and your health could transform. Sleep is when your body repairs itself, your brain consolidates memories, and your heart finally rests. Don't let a simple habit like sleep position undermine all of that. If you found this guide useful, share it with someone over 60. They may not realize that small adjustments could have life-changing effects. Consult your doctor before making significant changes if you have existing health conditions. Sleep smart, sleep safely, and your future self will thank you. Now I want to hear from you. Which sleeping position have you used for years that might be causing harm? Are you ready to try one of these changes tonight? Comment below. I'd love to hear your experiences.